Welcome to the Invite Health podcast, where our degreed healthcare professionals are excited to offer you the most important health and wellness information you need to make informed choices about your health. You can learn more about the products discussed in each of these episodes and all that Invite Health has to offer at www.invitehealth.com/podcast. First-time customers can use promo code podcast at checkout for an additional 15% off your first purchase. Let's get started.
Welcome to part 2 of our episode, Important Update, Vitamin C and COVID-19. We spoke a great deal about vitamin C and lung infections and viral infections in the first part of this episode. The University of Otago in New Zealand reviewed 16 human clinical trials. They published their findings in the journal Nutrients. Your important immune cells that are first responders to viruses, called neutrophils, soak up vitamin C as you start to get infected. This is needed for the vitamin C to allow the immune cells to carry on. So you have to have enough vitamin C in your bloodstream at the time that you're starting to get an infection for the immune cells to work. 3 studies show that vitamin C improves neutrophil chemotaxis. So neutrophils are the first responders. They're your most dominant first responders to any infection. If they get there early enough, they could wipe out the infection frequently. They have to travel to get to the infection from other parts of your body. That's called chemotaxis. They soak up vitamin C so that they can go through chemotaxis. And 10 randomized controlled trials proved that the vitamin C is required for respiratory burst. In other words, for the immune cells to get to the site of the infection and then kill the virus, that's called respiratory burst, they have to soak up the vitamin C from your blood, whatever's available. If there's not enough available, they're not killing the virus very effectively. And it's also responsible for phagocytosis with macrophages. Macrophages are more stay-put cells, like in your lungs and your liver, etc. They clear out viruses and bacteria. They're huge cells. They literally engulf the virus and dissolve it. That's called phagocytosis. They require vitamin C to carry on with phagocytosis. Now, Leibniz University is over in Hanover, Germany. They said a number of different immune cell types rely on vitamin C. They accumulate it at the start of an infection. So if you have low vitamin C in your blood, you have reduced resistance to infections of all types, not just the COVID-19 infection, all types of infections. And greater intake of vitamin C equals better immune system function. At the end of this episode, I'll tell you how much I think you should take. A previous meta-analysis that I mentioned before shows that vitamin C reduces the duration of viral infections such as the common cold. There's been studies showing, like the Cochrane review, Cochrane database of systematic reviews. It's a very well thought of academic research group. They look into drugs and diets and nutritional supplements and types of surgery, etc., and laser treatment, and they see if there's enough evidence to prove that it's good or bad, that it works or it doesn't work. And when the Cochrane systematic reviews looked at vitamin C and the common cold, and they grouped together a whole bunch of studies, they found out that taking a vitamin C supplement reduced the duration of the cold. It lasted for a shorter time, but also reduced the level of the symptoms. It was a much milder cold. And in fact, frequently it was helping prevent colds. They've also shown in different reviews of studies that vitamin C helps prevent pneumonia. I mentioned that in the first part of this episode. In the journal Nutrients, the University of Otago, that's over in Australia, their Department of Pathology, vitamin C clears out spent, used neutrophils during an infection so they don't damage nearby healthy tissues. They also enhance the formation of B and T cells. So let me tell you what that's all about, because that's really important. B cells are cells that create antibodies. They're also called immunoglobulins. In other words, that's what gives you resistance to many infections. The antibodies are specific for a particular infection, and once you make them, the immunity can be very long-lasting, and then you probably won't get the infection again. For instance, people who had the measles or chickenpox viruses as a kid they create antibodies on their B cells, and later on, if they get exposed to the virus again, they release these antibodies and they kill off the virus and they don't get sick. T cells do a number of things for the immune system. Just like B cells, they're highly educated. They're called acquired immunity. And they help stimulate the production of antibodies and other types of cells that kill viruses. And then they control the immune system to kill the virus or a bacterial infection properly. And then at the end of the infection, they call off all the immune system cells so that they don't hurt you. You don't want consistent inflammation, chronic inflammation by the immune system. Supplementation with vitamin C also helps prevent and also treats respiratory tract infections and systemic infections. And treatment requires higher doses than prevention. So here's a study that just came out in the journal Critical Care. Vitamin C levels in patients with SARS-CoV-2, that's the COVID-19 virus, associated acute respiratory distress syndrome. Once again, acute respiratory distress syndrome is when the lungs lining swells with fluid and you can't breathe, and that's really dangerous. So they said plasma vitamin C levels drop like crazy in people admitted to the intensive care unit with COVID-19 if they develop acute respiratory distress syndrome. The vitamin C levels are undetectable in more than 90% of these patients. So the patients that are admitted to the intensive care unit with lung symptoms and difficulty breathing, their vitamin C is so low that 90% of them, they can't even detect any vitamin C. They said, moreover, vitamin C may have implications for the treatment of COVID-19 associated acute respiratory distress syndrome. Moreover, other clinical studies that included surgical patients and patients with pneumonia showed encouraging results in terms of decreased incidence and severity of lung injury and mortality. In other words, if you have sufficient vitamin C, it helps protect your lungs, it helps prevent severe lung injury, and it helps prevent you from dying, according to this report in the journal Critical Care. So an article came out based on research, Vitamin C and COVID-19. Researchers call for status testing and intravenous oral supplementation. Listen, there's no real cure for COVID-19 yet. And the only thing that's been shown to really work is the corticosteroid drug dexamethasone. Nothing else is really showing that it's working well. Vitamin D, vitamin C, and zinc are showing that they have some activity. So this is according to a yet-to-be-published review. Researchers from England, New Zealand, and the United States said it was common to see very low levels of vitamin C in the blood of patients hospitalized with COVID-19. So a study in New Zealand found that patients with pneumonia had lower vitamin C blood levels compared to people who were healthy, and the patients in the ICU, the intensive care unit, were extremely deficient in vitamin C. So patients with pneumonia drop in vitamin C. If they wound up in the intensive care unit, they couldn't even find the vitamin C. A study from Barcelona found 17 of 18 COVID-19 patients, we have the whole numerical system in there, 17 out of 18 patients with COVID-19 in intensive care units had vitamin C deficiency, not just low, but deficient. While a study that just came out of Colorado, COVID-19 patients admitted to the intensive care unit had extremely low levels of vitamin C, and non-survivors had the lowest levels. They had much lower levels. They had half with overt deficiency levels found in scurvy. The researchers said that the blood levels of vitamin C decline rapidly when you have an infection. There's a lot of countries battling COVID-19 infections right now. Vitamin C may be a potential adjunctive therapy because it's so safe and it's low cost. They go on to say vitamin C has antioxidant, anti-inflammatory, and immunomodulating effects. Immunomodulating means it helps control the immune system. And evidence to date indicates that taking vitamin C by mouth, anywhere from 2,000 milligrams a day to 8,000 milligrams a day, may reduce the incidence and duration, how long they last, of respiratory tract infections. And intravenous vitamin C, 2 grams to 24 grams a day, has been shown to reduce the risk of dying, to reduce mortality rates, intensive care unit stays, hospitalizations, and time on mechanical ventilators and severe respiratory tract infections. So it sounds like they feel vitamin C is like really something to add right now. This review is currently awaiting peer review before being published in the Nutrients. That's the journal. The journal is called Nutrients. In one randomized controlled trial in China, vitamin C was given intravenously 24 grams a day. That's 24,000 milligrams a day to COVID-19 patients on ventilators. Okay, that's unbelievable. It reduced their mortality rate by 68% in the most critically ill patients compared to placebo. So adding vitamin C by infusion, intravenous infusion directly into the vein, 24 grams a day, reduced the death rate by 68% in people with severe COVID-19 infections. I mean, is there a drug that does that? I don't know. I mean, does dexamethasone? I know dexamethasone is keeping people alive. They say aspirin does also. They were saying famotidine, the drug for ulcers and GERD, may help also, but I don't know if that's true because some of the research says it's not true. There are similar randomized controlled trials in progress right now in Italy and Canada about vitamin C in COVID-19 patients. Now, according to the authors, there are currently trials underway at the Mayo Clinic in the U.S. assessing giving vitamin C supplements to patients with COVID-19 in the hospital. They said the single biggest life-saving impact that we can make in the short term is to take vitamin C in high doses. For those in critical infection, I hope ICUs will start to use vitamin C as standard practice, as China is already doing. Now, you can't really overdose on vitamin C because the body regulates it. If you take too much vitamin C, you lose it in your urine quickly. So it's very safe to use. It's safe, it's non-toxic, it's not expensive, and it's important for helping to shorten the duration of viruses and to help prevent them from getting too dangerous. I think it's something well worth using. So how much would I use every day? It depends on your health. If you're a smoker or a diabetic, you need more. Each cigarette burns up about 25 milligrams of vitamin C in your bloodstream. And diabetics utilize vitamin C very poorly, very inefficiently. So I would give a diabetic 1,000 milligrams 3 times a day with their food to saturate their blood with the vitamin C. For you and me, 500 milligrams twice a day, if you're not sick, should be plenty. If you start to get sick, go up to 1,000 milligrams twice a day. You also want to be on some zinc, about 30 milligrams a day. You want to be on vitamin D3, about 2,000 to 3,000 units a day. Always take that with food, just like the vitamin C. Take the zinc with food also. You also might want to be on glutathione lozenges. There's increasing releases of information on an antioxidant called glutathione helping to protect the lungs in people with COVID-19. So thank you for tuning into the Invite Health Podcast. You can find all of our episodes for free wherever you listen to podcasts or by visiting invitehealth.com/podcast. Please make sure you subscribe. Please leave us a review. You can also follow us on Facebook, Twitter, and Instagram at Invite Health. I hope to see you another time in another episode of the Invite Health Podcast. Thank you so much for listening. Have a good day.